Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang-Sharpe, IBCLC Director of Communications, and one of the MCs here at Gold Learning. Welcome to everybody today. I'm so excited. Look who is here with us today. Thank you so much for joining us. We're going to be chatting with our friends in just a moment, but I'm here to tell you, it is that time of year. We're ready for our Gold Lactation Conference, and we're inviting you to come and join us, of course, over on goldlactation.com. All the details that we're going to be talking about today are over there, but we just wanted to give you a little bit of an inside scoop of what's coming up. And of course, how it all began here, because we have been in the planning stages for over a year now, and we're truly dedicated to wanting to make sure that this conference is all about you and for you and your community. So truly excited about that. This year, we're celebrating our 18th year. I don't know if you can believe that. Many of you will tell me that you've been here from the very beginning, which is truly exciting. And many of you, of course, come in internationally around the world, and we're now reaching over 90 countries with 4,500 attendees. Can you imagine? And it still feels like a village. That's what I love about being here at Gold, is that it really is that community feel, but so many of you benefit from being there. So this year we have over 29 global speakers in the main program, and that is just amazing. It has also over 30 hours of education. So for those of you who are coming in, you know you have to recertify. You'll be looking obviously to get your CERPs, and some of you will be getting your nurse contact hours as well. I know that we have we had our registered dietitians coming with us as well, and many more, of course, with your CEUs and all those things. Registration is open, as I mentioned, so you can head over to the website, goldlactation.com. We open up on April 2nd, so that's our very first day. And those of you who have been here before will know, of course, we have our keynote on that day. And what does that mean? Well, we have an open access and free presentation with the absolutely delightful Jacqueline Kinser. I got to sit down with Jacqueline today, and we were going over some of the things that she's going to be sharing. And let me tell you, you do not want to miss that. And you can register for that on the website today. So make sure you go reserve your seat over on the website. She's going to be talking about diving into the nuances of clinical sucking skills, bridging the infant oral function and breast physiology. So, I mean, this is just a topic that she is hardwired, I'm sure, knowing all of these things. But for her, the knowledge translation, really understanding that nuanced behavior is, well, you just have to come and listen to know. But you are going to benefit so much, skills that you'll be able to put into practice right away. So come and join me on April 2nd for the opening keynote of Gold Lactation, and you can find all the details on our website. Okay, let's meet our friends and see who is with us today. I am absolutely delighted to introduce to you our program chair today, Melissa Cole. Melissa is a board-certified lactation consultant, neonatal oral motor assessment professional, and clinical herbalist in private practice. Melissa has been passionate about providing comprehensive lactation support and clinical lactation skills for health professionals. Melissa holds a Bachelor of Science degree in maternal child health and lactation consulting, and her master's work is in therapeutic clinical herbalism. Melissa actively conducts research and collaborates with several lactation and healthcare professional associations. Welcome, Melissa. It's so good to have you here today. And of course, we have Fleur Bickford, who is here, who has an extensive background in perinatal health and is a registered nurse and international board certified lactation consultant. Fleur's clinical experience in perinatal care as a registered nurse, working in obstetrics, combined with her professional experiences with educating both families and healthcare professionals, lends themselves well to her role here as Director of Educational Programming. Welcome back, Fleur. It's so good to have you here too.
Thanks so much, Fiona.
And of course, we have Christine Staricka here. She is also an IBCLC and childbirth educator with a background in multiple clinical settings. She joined Gold's education planning team in 2022 and brings experience in planning lactation education events on local, regional, and national, and I'll say international platform as well. Please welcome Christine Staricka.
Thanks so much.
Well, of course, I'm excited to have you all in one room here together. It's been like a hot minute since we were planning this event, and it took a lot of hours. Sometimes we spent many of an hour debating, discussing, talking all about it. And for those of you who have been involved in event planning before, you know what goes into planning a conference. And of course, this is our biggest yet, and we're just so delighted to be here and really serve our communities. I think that we can all say that. So as far as, lactation professionals, there just is this constant need to make sure that, again, up to date, making sure that we have the latest research. Many of you ask for clinical skills. You want to be able to get that information and take it right into, your family's homes, the hospital, the community settings, wherever you are. So we're going to talk about a few of those things throughout this session here today. And Fleur, I'm going to start off with you and just saying, tell me a little bit about the advantage, that this conference actually gives to our participants.
Thanks, Fiona. I think one of the really interesting things about GOLD is that it provides immediate access to some of the, most recent research. And research is evolving at such a quick pace, and these days our way of digesting that information is changing. And if you wait for it to come out into a textbook or even guidelines, sometimes by the time it does, you're behind things. So having access to this information immediately is such a benefit. And one of our goals is always to provide programming that is going to be translatable right away and help people put things into practice with their clients in order to help provide improved outcomes, improved quality of care, improve self-confidence for our delegates, knowing that they're able to provide that quality of care. So really excited to have this program that is based on, as you mentioned, 18 years of delegate feedback.
It's incredible. It's really incredible, I have to say. And I know you and I were always talking about those learning gaps. And I know that's what you were, talking about. There really are sometimes some really big gaps. So here we are. Tell me, Melissa, tell me a little bit about, the need for why do we even need lactation professionals to be so up to date? Because it used to be, this is not how we used to receive information. So tell me a little bit more about some of those things and maybe what has become really popular in our learning together on online offerings as well.
Absolutely. I think that what we're recognizing, and this has been something we've known for a long time, is that feeding issues are multifactorial, right? So we cannot say lactation is this basic science. We know it's complex. We are dealing with usually a parent, an infant, maybe multiples, and there's so many layers to the issues we work with. And so to really come out of a learning program, being able to actually have hands-on skills that are really adding to our toolbox in a fresh way. And I have listened to Gold conferences for these 18 years and have recognized how many new and hot topics that are always emerging because we keep understanding we don't know what we don't know. We're hungry to learn more. We get to listen to colleagues around the world and hear their insights and really take away actual tools we can use in clinical practice because we do deal with complex issues.
Yeah, absolutely. Yeah. And it's changed so much, I think, over those years as well, as you said. And this really is part of my question to you, Christine. Can you talk to me a little bit about how that shift has moved us into this sort of collaborative care model? Because I feel for so long we were so isolated and siloed in our profession, but what's happening now?
Well, thank you for this question because it allows me to expand on exactly what I was thinking as Melissa was talking about the way that we learn and the way that we get information today. Because we have this instant access to information from people all around the world, we are able to hear back not only from our colleagues in the lactation field, but people in related disciplines. And we're able to learn from one another that's what collaborative care really is. It's understanding what other types of supportive and complementary therapies are available out there and learning about how people support lactation in other places, in places where there are different resources, where there are different priorities. These things are important because they inform us in ways that we can expand what we are able to offer to families. And what that does is it allows us to meet the needs of this ever expanding diversity of clients that we are seeing. As more and more people around the world are understanding the importance of breastfeeding and putting priority on that, we are able to provide them with ways to make it work for them in ways that feel good for them, for their family, for their goals, and for the reality of their lives.
Wow, I think that just brings me so much joy, because it means that we're connecting the whole community, right? That's what really it's about. And we're leaning into others to support us. And they're supporting us, our families, and we're getting the results. It's true that we're seeing, when we can collaboratively work in our communities, we're seeing better outcomes. And that, of course, that's what we live for. That's what we're all here for. We want success for our clients, however they deem that success, right? So that is just wonderful. All right, let's dive into some of the juicy parts of the conference, some of the topics, some of the new things that are coming up, and let's touch on some of those. So I want, Christine, since you just were talking about some of those things, can you maybe jump into some of the topics that you love this year, and share, why you're interested in them?
For sure. One of the questions that I hear a lot, and I'm sure all of you do as well, the question of exercise and lactation during the lactating period of life, because so many more people are understanding the importance of that for wellness, and people want to be able to move and expend energy and gain energy through exercise, and they just worry about how it will impact their lactation journey. So we'll have one on making muscle and milk at the same time. And then we're also going to have a session talking about how we adapt the support and assessment that we do for families who are identifying themselves as having neurodivergent properties, within the parents and within perhaps even other members of the family. How do we help them navigate the lactation journey and early parenthood when they are identifying themselves as having these different qualities that make them feel like certain parts of lactation might be challenging in ways that we aren't used to looking at. So I think that one's going to be a fascinating look too.
Oh, you picked some good topics there, I have to say. I was just thinking about the, exercise and lactation and how that has changed over the years, and how we are very conscious about our health, particularly through the perinatal period. I think that's something that's coming up more and more, and how that has changed, over the years. So that's super interesting. And then you mentioned working with neurodivergent families. So yeah, that just strikes me as another really good and big topic, because I think we have spoken about, when the breastfeeding parent is neurodivergent, but now this is getting expanded into families, which I think is such great value. We're all learning and receiving information so differently these days. So yeah, this is something that really relates to you, Christine.
It does. It just speaks to me that, every family has its own needs, and every person has their own, qualities, and they can describe best what will work for them. And we just need to be open to that and, ready to adapt how we practice lactation to meet those needs.
Yeah. Yeah, absolutely. It's going to be all about adapting this year, right? And making sure that we're on point. Melissa, I know that you've chosen some great topics that really stood out to you this year. Why don't you share a little bit about them?
Yeah, a couple that I'm interested in. There's one called Relieving Discomfort, Non-Prescription Cold and Pain Relief While Breastfeeding. And this spoke to me because we have so many families that just because they're lactating doesn't mean they're not going to get a random virus, have an issue with pain or inflammation or something that they need support around. And all too often, especially with over-the-counter remedies, we're either, don't take while you're pregnant or lactating, or ask your provider. And so families are left in a difficult position of knowing, how can I get enough information to make an informed choice when I might need some support around a health issue, and it's not coming from a prescribing provider? So what do I do? And so I think this is going to be a really interesting talk, because I just feel like there's an upswing in families coping with different illnesses and viruses and different things where we might need to provide some quality information so they can decide what are their, the risks and the benefits of a certain medication or something over the counter. So I think this will bring a good amount of perspective to a very important topic. And the that I was really keen on hearing is when sadness is not the symptom, clinical approaches for breastfeeding mothers with postpartum depression. As we know, we often think of baby blues or sadness as being a key element. And now that we have increased awareness on what perinatal, mental health issues can look like, how they can present, as lactation and infant feeding supporters, we are on the front line of being able to have some preliminary screening when families are having a difficult time, to get them to the resources they need to make appropriate referrals. And sadness isn't the only thing we need to be looking for. So I think this will give us some greater insight in how we can be better screeners and get families to different aspects of therapeutic resources they might not be manifesting as just sadness, but other aspects of perinatal wellness that need support. So I'm excited for that talk.
Oh, fantastic. It's so interesting. While I'm listening to you talk about this, I'm smiling to myself, because honestly, I'm thinking, every year I think, well, what else? What more is there that you could actually learn? But honestly, every single year we come back and we're like, there is a lot, and all these new things just in that topic, when sadness is not the symptom. And we do know a lot about perinatal mental health, but it has expanded. There's actually so many things involved now. And I think this is that's going to be like a must see for sure, presentation. But also thinking about non-prescription cold and pain relief while breastfeeding. I think one of the other things that I've seen, which actually ties into mental health too, is I've seen, breastfeeding parents often just go to one extreme or the other. And there's no sort of informed decision making at all. And they're either really, really deprived, or they're really confused about what they're taking, or taking something that there's a better alternative to, so yeah, just some great topics there. Fleur, you also had some interesting choices as well here in your topics. Why don't you share a little bit of what you're looking forward to?
Yeah, absolutely. And as I've been listening to Melissa and Christine and yourself talk, one of the things that struck me was how a lot of these topics actually tie together. Because one of the presentations that I'm really looking forward to is titled How Parents Regulate Their Baby's Nervous Systems, Biobehavioral Synchrony in Lactation. And I really love that, because this one's going to be taking a deeper dive into the look at what is going on with the dyad during breastfeeding, what's happening within the nervous system, and it leads into how does that impact baby's brain development? How does it impact parents' mental health? There's so many different things going on when families are breastfeeding, and it's not all about the milk. There's so much else going on. So I'm really excited to hear more about neurologically what is going on, and it ties into the mental health aspect. So really excited about that. And then another presentation that I was really excited about was one of our interactive talks. And this one is about avoiding burnout. And this ties into our own self-regulation, our own mental health, which is so important. And this is actually one of our ethics talks, because it is one of our, professional responsibilities to make sure that we're in a place of being able to be our best selves and bring our best self to our practice. So really excited for that. And there's going to be a lot of really good information about finding better balance for ourselves, creating individualized care plans, and avoiding that burnout. And it is an interactive talk. There's going to be an amazing meditation within that talk. So really excited about that as well.
Mm. I love how I love how you work, of course, Fleur. We've been working together a long time now. But what I know to be true of you is that you really look at things of how it impacts the core of our bodies, from infancy right through, of course, to adulthood. I know that you're very much wired that way, but it just reminds me that you always have this global picture, which of course is perfect fit for your job as well here at Gold. But it too, when you pick those topics, I'm like, oh yes, I knew you'd pick those topics because it's how you're wired, in yourself too. And I just love that. So yeah, you heard it here first. Fleur just loves things from the inside out, and deep, and how we're wired. Yeah, it's going to be really interesting to hear what is said about the nervous system and how it applies, what we can, teach our parents about, because I think that's really the key. But we do know, like this, when there's a dysregulation, things are not often going well, and getting folks back on track, or at least teaching them about that, is going to be really important. And you mentioned something really important too, and I want to get into it right now, is that we have our interactive sessions, and you mentioned one already, Fleur, but I want to tell the folks listening in that if they haven't seen them before, maybe they need their memories jogged. The interactive sessions are exactly that. We anticipate that you're going to be interacting with the speaker, lots of polls and questions. We even actually have some pre-homework for you as well. The pre-homework is definitely not a must, but it's there for you to kind of dig in prior to the session and get a little bit of an insight, kind of get wired and tuned in, just like if you were going to a workshop, to be honest. And it'll give you the opportunity just to set yourself up really well, come prepared, and get ready to interact with your peers. Melissa, I know that you wanted to talk about one of the interactive sessions as well. We actually have 4 in total, but tell me about the one that you're looking forward to.
Absolutely. There's one on the evolution of lactation aids, from nipple shields to silicone collection cups and beyond. And I think that obviously tools and gadgets are always changing in our field, right? Some say the same, some are brand new, and it's hard to keep up. And one thing I found in my practice is no tool is inherently good or evil, right? There's a clinical application and a time and the place for every tool. We need to know the risks, benefits, when it's applicable, when it would be contraindicated. And so to be a critical thinker around clinical tools, it's so important, right? We don't want to just buy the hype or the marketing and think like, oh, well, this is the hot new tool, so we need to use this. We need to be savvy clinicians in how we apply tools, how we learn about tools, and how we try to stay up on learning about all the different technology and tools that are available to us. So I think it's going to be a good way to practice our clinical critical thinking skills around tools in this interactive session.
Oh, tools are always a hot topic, I feel, and people have a lot of opinion about tools as well. But Summer Freeman is going to be here with us. That's actually going to be a 2-hour session. So come ready for that. Be prepared. Bring your snacks, whatever you need. Lots of, writing tools, but you'll be lots of interaction at that point as well. Christine, you also chose one of our, you wanted to talk about one of our interactive sessions as well.
I'm so excited, because how do we learn best as humans? We learn through story, and that's what case studies are. Case studies are stories that help us apply our knowledge. And so this session is going to help us look at what's in the books and what's in the theory, and then apply it to some real world case studies, and be able to compare that with one another. How would one person approach it versus how another person might approach it, and how things turn out based on those different types of approaches. I find that fascinating. It's just a great way to learn and to make sure you're really looking at these situations through a very wide lens by hearing how other people are looking at it.
Yeah, I'm definitely with you on the case studies. I think it's one of the ways that I learn best. I just learn best that way. I always call it the ride along, that you feel like you're right there with someone, and, that critical thinking part just helps expand my knowledge. Some of the other features that we have here at the Gold Lactation Conference, of course, are our panels. And this year we are bringing you 2 different panels. This is an opportunity for our professionals to sit down together and talk about some very significant topics. And Christine, you also, I know you love the idea of panels and collaborating and having folks coming together. So tell me briefly about the panel.
Really quick about this panel on keeping family at the heart, practical strategies explored. We really wanted to bring in some experts to talk about what the buzzword family-centered care really looks like in practice and how it impacts people, and what to do when, you know, what you're suggesting doesn't seem to fit in with what the family wants, or the family's reality does not match up with what they actually are saying that their goals are. How do we keep our focus on what they want when we know, you know, what will work for them and what is not likely to work for them? How can we still keep them centered and make sure that they feel respected and that their dignity is always upheld in our practice?
Oh, fabulous. Yeah, that is the buzzword, right? So that's really important that we learn more about that as well. We've got panel number 2 coming up as well. So we have this one with evidence-informed lactation care. Melissa, you wanted to talk just briefly about this one.
I do. This is about navigating practice amongst research gaps. And why I love this, both as a clinician and a researcher, it speaks to my heart because all of us would love 10 randomized controlled trials for like every topic we want to, implement in practice. And we know that's not the reality. So we need to be able to look at the hierarchy of evidence and say, all right, what does clinical experience show? What do those case studies show? Where is the evidence that we can access? And how can we keep growing a body of evidence and creating study designs that can answer the questions that we have. So I think this will be really a good session where we're getting the expert opinion of several panelists who have real life experience and learning from them about this important topic.
Yeah, absolutely. I do love bringing the professionals together. I have to say it's one of the highlights for me, at the conference, and just to hear them, really talk it out. Fleur, there's more. There's more in this program, right? We always have some specialized packages. We call them the add-on packages. These are the packages you can add on to your conference. I know that you wanted to share this year that we have 2 brand new packages.
Yeah, we absolutely do. And these packages are for those of you who just can't get enough and want to keep learning. And I know there's lots of you out there. And the first package that we have is Unlocking Milk Production, Keys to Clinical Assessment and Management. And really excited for this one. It's going to be an interesting mix of, it was designed specifically to provide both research, catching up on some of the latest information on hormones and the biology of making milk, but then also looking at clinical aspects, things like exclusive pumping, supporting milk production beyond 6 months. We're talking about infants. We don't very often talk about what's happening beyond 6 months. So really excited for that. Talking about perceived insufficient milk production. Again, that body-mind connection is so important. To talk about low milk production triage, developing practical care plans. So, along with the research and the specific clinical situations, we always want to have something in there where we're tying it all together as well. So I think this package does a really great job with that. I'm very excited for this one.
Yeah, absolutely. Yeah, these and the packages are always very popular because they're really concentrated in that one area, which I absolutely love. Melissa, you also wanted to just share a little bit about our breastfeeding and perinatal mental health add-on package as well.
Yeah, absolutely. And I love the subtitle for this, Practical Tools for Fostering Emotional Safety. Because this package covers a broad spectrum of topics in the realm of perinatal mental health and also different learning styles and infant experience. So we're not just looking at one aspect of mental health. But why I think it's important is that it's everybody's job, right, to be looking at the safety, emotional well-being of clients and the families we serve. And even if that's not our direct role to care for that aspect of their care needs, we should be able to recognize, to point families towards certain resources that are important and vital in our community and beyond. And also I see there are going to be some topics on like oxytocin and other factors looking at neurotransmitters and the physiological component of perinatal mental health. So I think it's robust. It is that concentrated topic, but we have so many different topics within this one package that I think it's going to be so exciting. I'm looking forward to listening in.
Yeah, I feel like this package is very robust. It's going to give you the tools, you know, when you get into those situations where it isn't just about the latch, that it goes way beyond that, and how to find a place for families just to, you know, realign themselves and, you know, talk it through, and maybe then, you know, obviously refer as well. So I love those two packages. Christine, I know you wanted to just tell us briefly today about the other add-on packages, which will be available to our participants during the session. I think there's 3 more to go here, correct?
That's right. I mean, it doesn't end there. There's more. If you are interested in things like lactation care plans, infant sucking skills, and more case studies, you are going to love these additional packages we have available.
Absolutely. So lots of choice, lots of room to grow in, you know, in the conference this year, which is really exciting. And I will tell you as well that we have our networking sessions back this year. If you don't know what those are, that's where you all get to come together. That's right. We invite you to come in. We have Zoom rooms set up and we have different topics, and they are facilitated by one of you out there. And many of you have done this before. So we do have a room for lactation professionals in private practice, peer counselors, when a consult time is limited. Oh, who doesn't want to be part of that one? If you're a student studying to become a lactation consultant, there is a space for you as well, and they'll all be up on the website. Now, before we wrap things out today, I just want to talk a little bit about, once again, the dates that you want to put on your calendar. April 2nd is our opening keynote with Jacqueline Kinso. So make sure you get that into your diary right now. Register online at goldlactation.com. And as well as to bookend our conference, we actually have Janiyah Williams, and she's going to be with us here on May 13th. Our other keynote, our second keynote of the event, very exciting. You'll be able to come and listen to Janiyah as well. She's going to be talking about achieving lactation excellence, unleash the power of caring with impact, equity, and evidence-based support. Oh, definitely not to be missed there. So do join us May 13th. Put it on your calendar right now and register to reserve your seat. Well, thank you so much. Well, it's been a whirlwind, right? I mean, you want to go to the event right now, but we've got a couple more weeks before it goes live, of course. But thank you so much to my colleagues here today, to Melissa, to Fleur, and to Christine for joining us. It's been absolutely fabulous. Again, sitting down with you, always a joy to hear what you're passionate about as well. Just a couple more things before we go here. Quick reminder that the event runs from April 2nd to June 30th. So lots of time to come to the live sessions, and all of the presentations are recorded so you can listen at your convenience. You can listen more than once. It's absolutely fantastic. We are celebrating our 18th year this year. And boy, it's been wonderful to see this conference grow. But it wouldn't have grown if it hadn't been, of course, for all of you. So thank you so much for participating. All of course, it's a live and on demand, as I mentioned, which makes it really easy. But if you come to the live session, we promise you that you'll get an opportunity to dive deep, particularly in our interactive sessions as well. We want to hear from you. Bring your expertise as well and share with everyone online, you know, what are the things that are important to you in your communities. Join us on our forums. If you're listening to a recorded event, and post things on there, you can interact with the speakers, and it will be, you know, of course, our pleasure hosting this event alongside you, and we can't wait to see you. Join us on our website right now at goldlactation.com. You can register for this event right now. Thank you so much once again to all of our guests here today. It's been my pleasure hosting, and I'll look forward to seeing you all very soon online. Bye-bye for now, everyone.